Good afternoon, Chair and members of the committee. My name is Danielle Moraes, and I'm a registered nurse testifying individually today in support of Senate Bill 485, an act to establish safe staffing levels at skilled nursing facilities. This bill would require the Department of Public Health to establish enforceable minimum staffing standards for skilled nursing and long-term care facilities. Specifically, this would include a minimum of 4.1 hours of care per resident per day and a clear set staff to resident ratios. Inadequate staffing in long-term care facilities is not a new issue, and it's become increasingly urgent. Research consistently shows that lower nurse staffing levels are associated with higher rates of pressure injuries, infections, medication errors, falls, hospitalizations, and in unfortunate cases, even mortality, which most of these things are preventable. When nurses are responsible for too many residents, necessary care gets delayed, assessments are rushed, and early signs of deterioration can be unnoticed and missed. National workforce data shows that over 400,000 long-term care employees left their positions during the pandemic, which already worsened a strained system. And at the same time, the population over age 65 continues to grow, and it is projected to increase significantly in the next coming decades. So that means the demand for skilled nursing care is rising, but staffing protections have not kept the pace. The 4.1 hours per resident per day standard included this bill is evidence-based and associated with improved outcomes and reduced complications. Facilities that maintain stronger registered nurse staffing levels consistently demonstrate better quality ratings and safer care environments for their patients. While there are concerns about cost, inadequate staffing ultimately costs more. Preventable hospitalizations, infections, and adverse events actually increase Medicare and Medicaid expenditures. So safe staffing should be viewed as preventative investment that protects residents, reduces long-term costs, and strengthens the quality of care across facilities. While residents in skilled nursing facilities are among the most medically complex and vulnerable individuals in our healthcare system, many rely on public funding and they can't advocate for themselves most of the times. So ensuring safe staffing levels is both a public health responsibility and an ethical obligation. So as a registered nurse, I've seen firsthand how appropriate staffing directly impacts patient safety and outcomes. So for these reasons, I respectfully urge the committee to support Senate Bill 485 and advance it favorably. Thank you for your time and consideration, and I am happy to answer any questions, or feel free to contact me.